Hi, this is Swati Wag, the Science Outreach Librarian at Benedictine University. Today I'm going to walk you through how to search PubMed. That is the premier indexing and abstracting database of the National Library of Medicine. You access it right from this page. You click on the library and we ask that you go on this through this database, through this library portal, because that will let you download all subscription journals that we subscribe to. So you don't have to pay for it. And if you go somewhere else and go to PubMed, you won't be able to get that advantage of using our portal. So on this page, I'm not going to do anything here because I want to show you something called mesh. We talked about it in the PowerPoint. So now our example is global warming and infectious diseases, emerging infectious diseases. So in mesh, I'm going to put global warming. I'm going to put climate change, and then I'm going to say search, and it'll tell me here is the climate change. That is a heading, right? And I'd already done this search and I'd showed you on my screens what it was like. Climate change includes global warming and sea level rise. So all these two keywords are mapped to this one climate change word. So you don't have to type it out again. You don't have to put climate change or global warming or sea level rise to get the information. That's the advantage of using the um, the mesh heading. The second thing that I had in mind was also um, emerging infectious diseases. And this is where I'm going to go and look for. And you will see that I found communicable diseases. This is what we call the scope node because it tells you what it includes that are moved novel in their outbreak ranges, geographic and host, or a transmission mode. Year introduced 2001, so this came up in 2001. And these are called the subheadings. This is what you can get the aspect of that. So like epidemiology or etiology, that's the aspect of that subject and communicable diseases that it's looking at. Now we could have looked for surveillance. Now surveillance is not a subheading here, so we can't do that. But I have put it down. It's communicable diseases emerging. That's the preferred word, and that's how I've done. So now, following the same thing, I also told you something. These are all the possible keywords we could have searched under. So all of these words, all of these phrases are mashed to this one communicable diseases emerging. And the last section is I told you there was a classification scheme just like in the species. So here we have all mesh headings, diseases category, and all of that. And then under communicable disease emerging is what it is under. There is nothing below it. So we don't have to do related terms or anything. That's all we need to put mesh. And then I'm going to do the search. Okay. How many do I get? When in this, I will do search PubMed. And I get about 108. And you know, for the sciences, 5 years is what is relevant. And then I also want to do something like the Medline is a journal subset of PubMed. It means that it contains only those journals that are indexed, the journal articles that are indexed. It doesn't include books or conference papers or anything of the kind, only journal articles. You could do that, and then you could look at additional filters and see what you want on here. I'm not going to do anything here. I'm just going to leave it that to you. I could do language because I would like to do only English because I don't know any other language, and I'll say show. So all these are 5 years and all English language articles. And we have about 50 of them. And you can look at it. If you want the most current, I would rather, if you don't know anything about a subject, you would go to a review article. A review article is not considered primary literature. I think I explained it in what is primary literature in this section there, so you can read it up. A review article is considered a secondary, but if you don't know anything about a subject, you can look at it and know what the background information is in this review article. It says spread of infectious diseases. This is something you can think of looking at. And then suppose you want to look at some other art. This is a PMC article. This is another one we could look at. Climate change and zoonosis. That's a major part of what is happening here. A review of the current status, knowledge gaps, and future trends. So let's look at that, okay? And again, it's a review article. I don't want to look at review articles. I want to look at only um, research articles. This is also, it says there. And then I can put there, again, I can put not review. So it excludes all reviews, okay? And then I'll do a search. I should get much less than 31, okay? So now let me look at this, and this is 2018. I want something more than 2017, 21. I can just say I want 1 year because I want to see what's the most current information on it. And there are only 5 results, but that's fine. I can look at call a special issue on that. Coronavirus and pregnancy in deja vu all over again. Health and security environment. You can look at this one and see if we have it. Search in the library. It will tell you if we have it or not. And if it says we have to sign in, this is your Ben EDU login, which is what I'm going to put mine. This is going to be taking me to the page where it tells if we have it here. It says get an interlibrary loan, and so we don't take this journal. But if you had the PDF, it would have appeared there, but we can always double check, make sure that we really don't have it, okay? So then I'm going back to my search, wherever that was. No, I don't see it. Let me look again. Here it is. So let's look at 5 years again. And I'm going to look for something that's 2021 or 2022. This I'm doing this to show you something else, okay? Okay, let's look at this one. Infectious diseases research. It is, something you can get the full text here if you want, or even here we have Elsevier journal, so you can look at that. This is important for you because cite, it will give you AMA citing. So you can just copy and paste it in your bibliography. The second thing I wanted to show you is similar articles if we have, and cited by. Similar articles is, if this is something that you like, then other articles that are similar to that will appear here, and you can look at similar articles and it will tell you more, about that topic. And cited by, that article that was published in 2020 was cited in 22 February, this month of 22, by this person working on the pandemic, so you can look at that too. So you're going forward in time by 1 year looking at the cited by articles. And these are the references. Also remember, references have to be 5 years old or less, so this may not help you, but you can look at who has what references he has cited. 2011 and There are others. There are about four of them. There are 64 references. You can look at all of them and decide if some of them will be of interest to you. Okay. That's about PubMed that I was going to show and teach you how to use medical subject headings, which is controlled vocabulary, to put in this. Now, there's another thing that I wanted to, and when you're writing your paper, if you want to get all your references in one place, you can do this. You can say send to, you can do clipboard, and if you have some, we have something called um, EndNote that you can send it to, but that's another class or another time. So just let me know if you want me to teach you how to use EndNote. Set up an appointment and I'll be glad to do it. The other way you can do is you can email all these, all the results that you have here, all 30 of them. You put your email here and then do all of this and send it to yourself. It'll come as a bibliography in whatever style you want. So that's the quickest way I can tell you about PubMed. If you have more questions, you're always welcome to call me, text me at 847-312-4845. Thank you.